All right, well, I think we're beginning. Thank you all for coming, and I want to welcome you to the third annual Mayor's Opioid Task Force Legislative Breakfast. I first want to thank our state reps, our state senators, and of course, members of our Board of Aldermen, Board of Health, and the regional town officers and selectmen for joining us this morning. And I want to thank the members of our Mayor's Opioid Task Force for the continued commitment to prevention, treatment, and recovery in the Greater Nashua area. We convened the Opioid Task Force back in 2016 in order to drive the efforts of working collaboratively with providers, with service agencies, and community partners to tackle the very complex issue of opioid addiction and substance use disorder. Just over the past year, although we have seen a decrease of 23% in total overdoses and a decrease of 41% in fatal overdoses, all good news. This is according to AMR data. At the same time, we've also seen an increase in the number of mental health related emergency room visits and an increase in suicide deaths and despair. We saw a 63% increase in suicide death rate from 1999 to 2017, and this is in our region, where the national rate was only 33%. In response to this, we formed the Mayor's Suicide Task Force to convene aldermen, first responders, and community stakeholders, along with our public health department, to explore this problem. The Suicide Task Force has the mission of developing goals and strategies to work together to create connections and reduce isolation, and to reduce risk factors, reduce stigma, and of course, in the end, reduce suicide. COVID-19 has not derailed that goal, and as part of this effort, we're launching the Know the 5 Signs campaign, so that people may know and understand the signs of a mental health crisis and where to go to access support and help. Today, we will be discussing increasing resilience in the Nashua community using a COVID-19 lens. A conversation on why behavioral health issues such as substance use disorders, mental health, and suicide prevention are essential during the COVID-19 crisis. As vaccines become available and we are able to move beyond COVID-19, we need to assess what changes that we have made are meeting the needs of our community and what is still needed. One of the takeaways from our previous legislative breakfast was learning about root causes of substance use disorders, mental health crises, and suicide often are related to trauma experienced during childhood, as well as to the environment in which we live and were raised. Today's conversation will highlight why in the time of COVID-19, behavioral health still needs to be a priority for our community. The opioid crisis has not disappeared. Even though we have seen decreases in overdoses, and we're fortunate there because across the country, other communities are still seeing increases. How do we prepare for what comes next while building up our community's resilience? This morning, you will hear from a panelist of professionals whose work is focused on building resilience in individuals, families, and in communities. Thank you all for taking the time out of your morning to be with us. And thank you, of course, for the important work that you do throughout the year. Please, during our forum this morning, ask questions and participate actively. And again, I want to thank you all for attending, and I'm going to introduce you now to Lisa Vasquez, who will moderate the panel discussion among our experts.
Good morning, everyone. Thank you so much for joining us this morning. My name is Lisa Vasquez. I facilitate the Mayor's Opioid Task Force, and I will be moderating this conversation this morning. You are welcome to add any questions you have to the questions section. We will be monitoring that section throughout the panel discussion. The members of the panel will speak for 5 minutes, and then we will have some prepared questions. After that, we'll open the floor and ask all the audience questions. Our panel today includes Director Bobbie Bagley from the City of Nashua Division of Public Health and Community Services, Dr. Cynthia Whitaker, who is the CEO of the Greater Nashua Mental Health Center, Kristin Markara, who is here from the Nashua Doorway, Jessica Parnell, Director of Revive Recovery, and Mike Apfelberg, who is the President of the Greater Nashua United Way. Welcome everyone to the panel. Good morning. And we will start, again, 5 minutes each. You will talk about the impact that COVID's had in your agencies during this past 10 to 11 months. What services are still being provided to maintain, clients and staff safety, and what services are still needed to continue to provide services to our community and increase resilience. And we will start with Director Bobbie Bagley.
Good morning, and thank you, Lisa, for having me attend this third annual legislative breakfast. I also want to thank everyone that's in attendance that got up early to be with us this morning. And for those of you who have breakfast, please enjoy your breakfast. And those of you who received breakfast from us, we invite you to enjoy that as well. As Lisa said, I'm Bobbie Bagley, the Director for the Division of Public Health and Community Services. And I will start by talking about some of the impact that COVID-19 had on our division as a public health department. As the public health strategist for our region, it was very important for us to be in a position to respond very quickly and collaboratively for this COVID pandemic with our community partners that included the hospitals, our city officials, our city partners from each of the divisions, our non-profit organizations, community organizations, and our faith-based organizations as well. As I think about some of the impact that COVID has had on our services and barriers, as you know, our public health department provides services including immunization, HIV, STD clinics on site. And so once the pandemic hit, we were not able to continue those services. We were able to continue with our mobile services in the community, which included SANA, which is our syringe services access in the Greater Nashua area, which addresses individuals that have issues with substance use disorder and making those services available. We were also able to continue our partner relationships with our organizations that provide recovery and treatment services and making those referrals, which was really, really important. As far as data that's been collected during this time that impacts the work that we do, it was really important for us to continue to provide surveillance daily on cases, on the outbreaks, on the investigations, on deaths as well, including testing. And so, for instance, right now there's 721 new cases in the state of New Hampshire. We have had 5,374 current active cases at this time, with 16 additional deaths reported as of yesterday. We have a total of 1,021 deaths, and we offer our sympathies to those families that have lost their loved ones during this time. We currently have 221 individuals that have been hospitalized over this time period, and overall, a cumulative of 64,258 people have been diagnosed since this pandemic began for us here in New Hampshire. We have had 90% recovered. When we do our testing, in fact, we do testing in Nashua. Right now, our state has a test positivity rate of 5.5%. In Nashua, we just did a testing clinic on Tuesday, and our test positivity rate is 11.4. So we're still seeing substantial community spread in our region, that number does seem to go up and down. But one of the things that we have also seen is that the data, as the mayor mentioned from AMR, shows that we've had a decrease in the number of overdoses in our Nashua region. And we tend to think about why that's occurring, because we know that COVID did not cure substance use disorder. And in fact, as you're going to hear from some of the other panelists, we know that COVID-19, this pandemic, also presents as an adverse experience for families, particularly those that are dealing with behavioral health issues, as well as individuals that have substance use disorder. One of the things that I did want to share with you this morning is some information that we were able to collect from individuals during a community conversations research activity that we conducted just prior to the COVID outbreak. And with some of the information that you'll see here is the reason why we think this is really important for us to have this conversation today, as well as make plans for what's expected as we continue to mitigate what we're seeing right now with COVID. So I'm just going to share my screen with you. Okay, I just need the controls, Nicole, to be able to share my screen. There we go. All right. So I'm hoping that you can see this. This is the one of the pages on our database, and we have quite a bit of information that we're collecting here and data. So I do invite you to go to our City of Nashua Live Stories database, where you will see our data dashboard, where you will be able to see data that we're collecting on COVID and other priority areas of focus that we have. And in particular, what I wanted to share was what we have seen with community conversations, some of the information that we were able to receive from those that participated in this particular research project. Our goal was really to get a better understanding of the impact of substance use disorder in our community, but more so to also understand some of those root causes. We had 222 participants either participate in in-person interviews or through surveys. We did online surveys and in-person interviews prior to COVID, and once COVID hit, we had to change strictly to the online. You can see here some of the numbers of the participants that were involved with the survey, the living situation of our participants as well. And one of the reasons why I wanted to take you here was we look at data, we get empirical data, which is numbers, and then we also get data that comes through focus groups or comes through stories. And some of the main things that I wanted to highlight here that's going to help us think about what we need to do to prepare as we go forward after COVID and continue during COVID. When you look at this story here, my brother went into a convenience store, helped himself to a pack of cigarettes, grabbed a beer out of the cooler, and then sat on the floor in front of the register and smoked and then drank his beer. And then he said to the cashier that he was waiting for them to call the cops because he wanted to go to jail because it was too cold outside. These are some of the circumstances or situations that some of the individuals find themselves in. You can see that we collected data across race and ethnicity, gender, education, and age. And I do encourage you to go and take a deeper look and a deeper dive at some of the information that's here, because you're going to see the vast diversity in the number of individuals that we were able to learn and gather information from. Most importantly, before I end, I wanted to bring us back to the root causes, because that was one of the things that we found we would hear over and over as we did our outreach, as we received calls from individuals, as we made referrals. We were hearing the stories of things that had happened in these individuals' lives that were not taken care of and that were identified as adverse childhood experiences. And our panelists that we have this morning are going to talk more about this as they also talk about what they have experienced in their services and their organizations during the COVID epidemic. We know again that this pandemic did not cure substance use disorder or mental health issues, but in fact, a lot of things are exacerbated, and there are things that we are not seeing currently right now. You'll be able to see more stories on our data dashboard. So again, I encourage you to go there to learn a little bit more about what we learned. That's going to help us prepare for how we plan to move forward in the work that we do at the health department which will continue to be collaborate with our partners, make the referrals, continue our outreach. We've also hired community health workers to help bridge any barriers or gaps with language and just helping people to build trust with us as a health department and working as liaisons with our community-based organizations that provide services. Thank you for listening this morning. We expect also that as legislation is being presented, that all of these things will be considered from what you hear from us this morning. Thank you.
Before we pass it on to Dr. Whitaker, I just wanted to remind people to be active participants in this conversation. So if you have any questions, please add them to our questions section. We will be monitoring that section throughout the entire panel discussion, so that way you can ask any questions that you that may arise at any time. I'm going to pass it on to Dr. Whitaker. Thank you.
Good morning, everybody. Hopefully you can see a slide that says Greater Nashua Mental Health on it. Awesome. All right. Well, I am Cynthia, and I'm the president and CEO of Greater Nashua Mental Health. And as Bobbie very eloquently put it, you know, a lot of our services have been impacted by COVID. And so just want to give you a quick little overview. So we are a full spectrum community mental health center, one of the 10 community mental health centers that's part of the Community Behavioral Health Association here in New Hampshire. And what that means is that we have programs that span the lifespan from children all the way to older adults and everything in between, with a lot of wraparound community-based services. And so when COVID hit, certainly like many others, we shifted many of our services to telehealth, got some training for a lot of our staff on telehealth. But when people think about telehealth services, when there's training for mental health in telehealth, they think about therapy, group therapy maybe, and medication services. They don't think about all of the wraparound community-based services that we do as an organization that really address social determinants of health. And so we didn't have anybody to look to how do we do those types of services via telehealth, and really had to kind of develop within our own strengths in our own community, what is the best way to address some social determinants of health when we can't be in people's homes and in the community with individuals unless really absolutely necessary. And so it's certainly been a journey for us. One of the other things that has happened for us during this time of COVID is that the state of New Hampshire recognized the need for first responders and other individuals who were significantly impacted by COVID to have better access to care. That avenues they would have typically gone to, folks in private practice or other places, might not have had the capacity to see them. There might have been a waiting list for those services. So we have a program right now called Rapid Response, which is specifically for individuals that might not have typically come to our services here at Greater Nashua. Maybe individuals who work in healthcare or who've lost a job, who work in a long-term care facility and have experienced a significant loss. We have a specialized group of staff working with those individuals right now in a kind of short-term way, help folks stabilize in the crisis, and then help them find long-term treatment if that's what's needed for them. Because what we don't want is people to wait. So what we've found is we've really needed to be flexible and creative during this time of COVID. We've really benefited from the relaxing of the requirements regarding telehealth, some of the geographic requirements or originating site requirements, being able to use the telephone with individuals has been pivotal in access to care during this pandemic. One of the questions that I often get asked that I am going to just take a minute to talk to, and then maybe we can talk some more in some questions, is what's the impact of isolation on individuals' mental health and substance use disorder? And the key idea is that isolation is a little deeper than we often think about it. So when I think about isolation in three different facets. The first being interpersonal, between people, which is often how we think about isolation. And so as a entire world, we've been creative to impact interpersonal isolation by having Zoom dinners and Zoom birthday parties and meetings such as this. And that helps us still interact with people and not feel alone in the world. But that's really only one type of isolation. There's also an intrapersonal isolation, an isolation from oneself or that impacts one's own identity. And so an example of this is if I've lost my job or I'm trying to homeschool, support my children remotely, I have new identities happening within myself, and I might feel disconnected from parts of who I used to be or what's going on for myself. And then the third type of isolation is more of an existential kind of isolation. A lot of people feeling isolated from a higher power or a faith community, or just what is the definition of life these days. And so I think it's important that when we talk about the impact of COVID, that we recognize that the adversity or the adverse experience is not just that we're not seeing people interpersonally anymore, that we're disconnected, physically distant from people, but that there's also an internal impact on people, or kind of a what is life impact on people. And that's what causes individuals to kind of experience symptoms with their mental health that they've maybe never experienced before, or to turn towards substances to numb those feelings or to try to feel better. And so that's what I'm hoping that we might be able to talk to check on about as we go along. So that's all I want to share to start with, and hopefully as we go, there might be some questions and I can be part of the conversation. So thank you for your time, and thank you for being here and listening.
Thank you, Dr. Whitaker. We're going to pass on the virtual mic to Kristin Markara.
Good morning, everybody. Thank you for inviting me. I would like to talk a little bit about the doorway. We stood up our program kind of right at the beginning when COVID started. So for us to compare where things were before, we can't do that. But I can tell you, kind of echoing what Cynthia talked about, the impact that COVID and the stress it has caused for people who already are experiencing substance use issue, and for those maybe who didn't, but as she said, kind of have turned to that as a means to help manage that stress. For individuals who already are have experienced those negative childhood experiences, don't have those healthier coping skills, often will turn to substance use. Some of the barriers we've experienced with COVID-19, obviously the increase in stress, people are unable to work. Lots of people, that financial strain is huge. People losing housing, some of the recovery houses not accepting people because of COVID outbreaks, recovery centers having to shut down their admissions. So that's delayed things. I think one of the really positive things I would like to say about what's been happening in the state is we've seen an increase in treatment centers, which is really fantastic. Treatment centers accepting Medicaid clients. So that's been a huge change over the last 5 years. So that's really excellent to see. In terms of, I think what would be helpful moving forward is being able to continue to connect with people via telehealth. We have been live the entire time, so people can walk in and see us at any point. But we do a lot of stuff via telephone, a lot of assessments. Our referral process, we do a lot, obviously, by telephone. We've been experiencing also an increase in stimulant use disorder. Alcohol use disorder now is at about 25%, which is huge. And there also is a lack of programs that address that. Our funding just changed. The grant changed for to address opiate and stimulant use. It used to just be opiate use. So that's fantastic. That's going to serve a lot more individuals. But we're still lacking in assistance for those individuals struggling with alcohol use. So I think that's one of the biggest things I would like to discuss further today. If anybody wants to talk more about that. The Governor's Commission did award a additional grant for us to assist those individuals. So that will be huge, but that will only go so far. So being able to continue to help those individuals beyond that grant is something I think I know we would like to see on the substance use field. In terms of, I probably should have opened with this. For individuals who don't know what the doorways do, we offer case management services, level of care assessments to make those referral to treatment programs. We distribute Narcan. We have paired up with the SANA program, the National Public Health Department, to go out and meet individuals on, out on the street, if you will. We assist with recovery housing. I'll give you a couple of statistics there. Since we opened our doors on May 11th, we have assisted 180 individuals with recovery housing, which is awesome. And then we have served, for the first grant from May 11th to December 31st, 430 individual unique clients. And then since the new grant started January 1st, we've served 124 unique individuals. So we're really excited and really happy to serve the city of Nashua and the surrounding region. So thank you for having me, and I welcome any questions.
Thank you, Kristin. We will now go over to Director Jessica Parnell.
Good morning, everyone. My name is Jessica Parnell, and I'm a woman in long-term recovery from substance use disorder. I'm really excited to be here today. Nashua is a tremendous community, and I have never been prouder to be part of such a community of leaders that care about us and recognize that substance use disorder is a problem, and despite COVID and all the implications that go along with that, our community is still struggling. Revive Recovery Center is a recovery community organization, and over the last 4 or 5 years, we've established ourselves as that safe place for anyone that seeking to get into recovery, maintain their recovery, develop their recovery plan. It's that place where we can find that human connection that we need to get connected with resources such as recovery housing, get connected with the doorway, financial assistance, workforce education programming, SUD treatment and recovery services. Since COVID began impacting our community members, we've actually increased our service delivery areas to include a new satellite location in Derry, New Hampshire. In addition to that, here in Nashua, we've worked with our partners over at Greater Nashua Mental Health Center for the Hillsborough County South Adult Drug Court Program. And in addition to that, we've expanded to the Rockingham County Drug Court Program, as well as Hillsborough County North, also known as Manchester. And so I think a lot of that came from, the judicial system identifying that if we want to address this, we need to add, recovery support services, because the more resources we have available, the better. The more support we can provide, the better outcomes we're going to have. COVID had a tremendous impact on our organization as well as the recovery community as a whole. For a short period of time, we had to shut our doors and kind of transition strictly to telehealth services, which, we just started doing this a few years ago in person. We have no idea how to do this over Zoom, or, getting the staff up to speed with utilizing these new tools that we've never used before and reaching out to those community members that aren't able to make it through our front doors. I think, and it brings me back to how RCOs were founded, right? The founders of AA said, we have 25 million people that are crossing our front doors. What about those ones that aren't? What are we doing for those that don't make it there? And so COVID kind of, gave us that push that we should have taken a long time ago. And, there's so many tools that we can use to reach those in need. I have to mention that I definitely couldn't have addressed this with our community members alone. Thanks to the New Hampshire Charitable Foundation and the United Way of Greater Nashua, we were able to, purchase cell phones and cell phone minutes and tablets and computers for our community members to utilize so they can continue engaging with us. We prefer to do it in person. However, now that we have these resources, we can continue meeting with people even if it's over Zoom, because something's better than nothing. A lot of our meetings had to shut down for a short period of time as well. And since then, we've been able to get the technology such as an OWL so that we can hold hybrid meetings and safely limit the amount of people that come through our door, but you can still join from home as well, which is something that blows my mind. And I'm really grateful to be able to continue providing those. Isolation, I know Kristin, mentioned it. It's impacted us all, especially for those of us whose recovery has been strongly established through that human-to-human connection we find in person. And, a lot of the RCOs across the state have done the same thing. And, we've also connected as the RCOs as a whole to be able to, establish those extra lines of communication across the state. I'm really grateful to be here today and look forward to, the questions and addressing these barriers as a community as a whole. Thank you.
Thank you, Jessica. We're now going to go to Mike Apfelberg.
Well, good morning, everybody. Welcome to the Mayor's Opioid Task Force Legislative Breakfast. We appreciate everybody coming on and joining us and participating today. I'm not sure why I always get to be last in line, but maybe that's because, I don't know. I just drew the straw. So anyway, I'm going to share my screen. Hopefully you can see just one slide, and that is coming up right now. So United Way has been around serving Greater Nashua since 1929. And what I would say is that we were founded during as a result of the Crown Hill fire back in the Great Depression. So our birth and our DNA come from an emergency and a crisis. And over the years, of course, we evolved out of that crisis to become a collective impact organization that promotes a community of nonprofits that serve the greater good and work together towards collective goals. The pandemic changed all of that and at the same time reinforced all of that. And I want to explain a little bit about what I mean by that. And hopefully you can take this and throughout the legislative session, it can translate into some specific areas that can provide some focus. So for us, what the pandemic did was it sort of brought us back to our roots. And that meant not just continuing to support the organizations in our community in their work, like Jess and Revive Recovery, as they pivoted to different ways of doing business, but also there were many gaps, true gaps in services that came about immediately and were identified through the pandemic, which put gaps that were otherwise, small little crevices and made them look like very large fractures in the earth. And so for us, that's been really instrumental in informing how we'd like to put some of our focus moving forward. I'm just going to give a couple of examples of things that we've learned that we need to continue to have some focus on. So let's talk about food. So food supports are always critical. We have some phenomenal organizations in our community, such as the Soup Kitchen and the Toll Street Mission, Salvation Army, the Corpus Christi Food Pantry, that provide regular service to clients who need food assistance. That's great. So where's the gap? The gap is that those are fixed locations that people need to go to. And in a pandemic, you start realizing that people are not necessarily going to be able to walk or drive or even take public transportation to these locations to get supports. That's a problem that exists all the time, not just during a pandemic, but becomes much more of a critical focus during a pandemic. And so as a result of that, we've established, for example, pop-up food pantries around the community. And we've established partnerships with the schools and the busing system to deliver lunches in neighborhoods. And we've established volunteer-driven delivery services from pantries, and we've established volunteer-driven grocery shopping systems to help people who are at home or cannot get out. Now, those are things that are going to continue to exist. And so those are gaps in our food system that we need to continue to look at and to address, that were brought about as a result of the pandemic. Ultimately, I do not expect that United Way will be the organization that provides those services. What positions us uniquely is our ability to be flexible and change on a dime. But over time, I would expect our currently existing food delivery systems to take over some of those roles, and we're providing a gap, a way to get across that bridge. Another example I wanted to bring about, talk about is, in particular, as it relates to education. So we've talked forever about the digital divide. We know that there are haves and have-nots when it comes to technology, when it comes to internet access. With internet access, we've focused most of our efforts and thoughts around communities where there is no broadband access, rural communities, places, for example, up in the North Country that don't have good infrastructure. But what we found during the pandemic is, which we knew all along, was that there are families that simply cannot afford internet access. Perhaps that used to be a luxury. Perhaps being able to get online used to be considered a luxury. But when your classes are online and you don't have access to the internet, if you can't get on the internet, you're not in class. And it's really as simple as that. So we've been able to address that gap by purchasing and distributing wireless hotspots to families. At this point, we've distributed over 400 of those. That's created access to over 800 students who didn't otherwise have internet access. Do I expect that we're going to continue doing that into the future at United Way? I do not. Do I expect that there are going to be some legislative initiatives that can help to bridge that divide? I certainly hope so. So that's another example. Also on the technology divide, we know that access to things as simple as laptops and Chromebooks became really critical during this pandemic. So we've been able to refurbish and distribute over 500 laptops to families where maybe 2 or 3 kids in a family, only one machine, couldn't afford multiple machines, and therefore they're competing for screen time. If your class is at the same time as your little brother's class, and you're competing for the same computer, guess what? One of you can't be in class. So those are the types of divides we expect to continue need to be addressed. And more broadly, the social determinants of health, which Director Bagley addressed early on. The pandemic has really highlighted how important it is that we continue to make sure that people are not isolated, that there's a focus on people who are lonely, people who need connective social supports to frankly prevent depression, prevent suicide. Those are issues that are going to need to be addressed as well. So there's a ton of stuff I could talk about, but I really wanted to make it clear that addressing gaps has been our role throughout the pandemic, and being flexible is really the watchword for every nonprofit in the community. Working together towards a collective goal is really what we all need to be doing, and being flexible and addressing gaps is kind of key. I'll take questions offline after, and I'm going to stop sharing my screen and throw this back over to, I believe, Lisa.
Thank you, Mike. Thank you to all our panelists for, can everyone hear me? Okay, thank you to all the panelists for your words. I have some prepared questions because so far we have no questions from the audience. What barriers were highlighted in accessing services in your agency? I think we talked some of those up, but there are also some that were not spoken of. So what barriers do you think that maybe weren't seen before that were really highlighted through COVID-19 in accessing services? Mike?
Yeah, so the biggest barrier is knowledge of where services actually live, and knowledge of which services actually are provided within the community. We have our statewide 211 service, which is a program of United Way that has seen its call volume spike to over 3,000 calls a day relative to coronavirus. And that call volume was prior to 211 being used as the offline vaccination registration system. So access to information and promoting that organizations work together to make it known what services they can provide is key, and making sure the public knows this is where I can go to find out what's going on is really important.
Does anyone else in the panel have Director Bagley?
Yes, thank you, Lisa. And that's a very important question when it comes down to identifying barriers. So there are certain things that we focus on because our agencies, are positioned to look at certain things. And what COVID uncovered for us was some of those things that are hidden even deeper than what's on the surface for our mission and our visions for our organizations. And I think Jessica said it when she said, we know those that are calling or that are trying to reach out to services, but what about those who don't believe that they can or don't feel that things are available to them because they're not presented to them in a way that makes it seem that they can access those services. So that's a barrier that was, uncovered. And so one of the things that we need to think about across all of our organizations and across our legislations and policies is how do we make sure that equity, is at the forefront of everything that we do across all of our population groups, race, ethnicity, gender, age, economic status, that we're collecting the data so that we can actually identify who is missing in those, in those groups for those services, because those were the individuals that were hit the hardest by COVID-19, and then also were kind of unveiled. So then we saw, oh my goodness, there's this whole group, that we generally do not see or hear from that we now have to make sure that we're providing services for.
Jessica?
Thanks, Lisa. So being that we're a community center, navigating and accommodating walk-ins was tough to manage at times. Normally you could come here, almost any time and just come in and meet with someone right away. So flexibility was kind of a struggle. And so we had to change, our protocols and our policies on, coming in and just dropping in at any time, which kind of stinks because, that's like what we like to do. We love to have our doors open at all times. We love to be that place where people can just come and unload and, get connected. And so that had to change. And, we've been able to, accommodate with switching over to telehealth. A lot of our community members struggle with technology. So getting them up to speed, getting my staff up to speed, I have to thank my staff for being super dynamic and, being able to drop everything they're doing and pick up, have 8 screens going at one time and, calling people, reaching out, offering as much as we can online. In a couple weeks, I'm really excited. We're going to be opening up like an open mic night. It's going to be, very safe and socially distanced and even offered virtually if people can, make it. Some of our groups, we started a crafting group during COVID, which, it's been interesting. It's been tough getting it up and running, but we found ways to get those resources out and offer it virtually. Some of our meetings had to shut down, but some meetings have reached out to us and started their meetings here because they weren't able to hold it at local churches, and having the technology to accommodate. So it's been tough, but we've done everything we can, and we're going to continue looking for new ways to continue reaching those that we might not have been able to reach. Going into different treatment centers, continuing, to provide information sessions whenever possible.
Dr. Whitaker?
Thank you, Lisa. I wanted to piggyback on something that Director Bagley was mentioning, and that's the equity for access, because I think this is a big learning that we have had in COVID, and both to highlight issues we had pre-COVID, but also in that sometimes our solutions are not equitable. So, our solution for COVID has been telehealth. And that's hard, as Jessica just kind of mentioned. Some of our clients, especially our older adults or those without internet access, struggle to have access there. Another problem or disequity with that solution has been our deaf and hard of hearing individuals. Even this platform today, as people's videos freeze, as people with hearing abilities, we just don't pay any mind. As long as we have access to the audio, we're good. But if an individual who is trying to communicate through American Sign Language really needs the visual, that solution also might create an inequity. So I really think that what Director Bagley said cannot be underscored. We have to champion that not only do our services need to be equitable, but so do our solutions need to be equitable. And so we need that collective voice to really find the solutions that are accessible for everybody.
Thank you so much. And thank you for everyone. I see the questions coming in. What data is being collected that impacts the work that you do? And what data do you wish was being collected that is not being collected? And that can also go into metrics that might not work at this moment in time, and we might need to change as well. Would you be able to answer that question? Dr. Bagley?
Jessica beat me on with the finger. One of the things that we have learned is that we needed to collect data better. As a public health department, we have metrics that we have to collect just because we have to do some reporting back to the state. But we have to collect that data better, and the domains of our data collection need to expand beyond, again, I mentioned like the 5, race, ethnicity, gender, age. We need to collect data so that we can stratify it, right? So we need that income data. We need to know about the disabilities in our community. And so those things are collected, but they're spotty. So what we need to do is work collectively. Our organizations are all collecting different types of data sets, and we need to come together so that we're all collecting the same type of data, so that when we really want to evaluate or analyze or assess our situations across our organizations, we're comparing, apples to apples, oranges to oranges. And so we want to work on a system to where we're doing that, collectively across all of our organizations, so that we can all have the same data that we're using. Again, because when we have that information, it allows for us to clearly be able to see where our gaps exist and where we need to put resources to address where those gaps are. And as Dr. Whitaker said, so that our solutions, again, are equitable. You're going to hear me say that a lot throughout this morning, because again, that's where we really need to prioritize to make sure that things are equitable across all of our solutions, all of our services to the population, so that we can serve them to the best of our abilities with the resources that we have.
Jessica?
Thank you. So I agree with Director Bagley 100% that, we're all collecting data in different ways, and how are we getting together and coming up with solutions as a whole? We can't do this alone. I know I can't. I wouldn't be here if it wasn't for, the other faces that appear on my screen right now. We know alcohol use is on the rise. What data is being collected and what resources or methods have been given to address that? What about meth use? We know that that's on the rise, and we can, see the impacts in our criminal justice system and on our police departments because of that. What data is being collected on the meth use, and what resources or data do we have to address that? Is there data being collected on the treatment for meth use disorder? And what are we doing for the treatment of that? I know this is kind of, something that's on the rise. I'm seeing it with the people I meet with on a daily basis. And, I feel like as if we're kind of forgetting that we're still in an opiate crisis. That use is still happening. We know that we're getting the Narcan out there at like a 23% rate that we're seeing public use of Narcan. However, I feel as if that needs to be 100%. Why is that not 100? And what are we doing to increase that as getting together collectively and getting it out to our community members? So I think there's a lot of data collection that still needs to happen. And, we need to come up with new equitable ways of addressing these.
Thank you, Jess. Michael?
Yeah, I was just going to comment on data collection. Is one of the challenges with data is that data is people. And when you're collecting data, we've tried as much as possible to make all of the services that we've provided to the public, and I know that everybody on this call struggles with the same thing, is how do you collect data on people without having people feel uncomfortable with the data that you're collecting on them? And what I mean by that is, just as a for example, when one of our pop-up food pantries is running on say a Wednesday afternoon, and 25 people come and get food, we've tried very hard to say it's open access. If you need food, come and get food. We're not going to ask you for your tax returns. We're not going to ask you for your address. We're not going to ask you really anything other than we know that just by virtue of the fact that you showed up, that you need something, and we're going to provide that and in a way that's comfortable. At some point, that cannot translate into data, and it needs to be made into data on who are you serving and where are the needs. I struggle with that. I throw this out here. Maybe somebody has a suggestion, and this is really more of a question. It's really more of a comment than anything else. Is we can measure outputs. How many pounds of food did we distribute? How many clients did we serve? But who are those people is much more difficult to do without putting the service itself at risk.
Thank you. How are you preparing for what's next after COVID-19, knowing that many of the root causes of behavioral health issues like substance use disorders are impacted by trauma, adverse experiences, and isolation? What happens after COVID, after we move beyond COVID? How are you preparing for that? Kristin?
Yeah, I don't know that there's a way to prepare. Just being as diligent as we can, being flexible, being committed, I guess, is how we're preparing. You know, addressing things as they come, and really just strengthening the relationships with other community partners, mental health center, you know, private practices, everybody, to ensure that we have those great relationships so we can assist people when they need it in the most appropriate way.
Dr. Whitaker and then Mike.
Kristin, you took some of the words out of my mouth, so I'm glad you went first. I do think collaboration amongst the community is what is needed to really address the impact that is to come. You know, as people are saying, kind of that second wave of the pandemic that is going to be impacted by isolation. And what happens when all the kids go back to school and we find out, you know, who's really behind and who struggled and maybe who had a learning disorder come to play, but nobody's been able to notice it, or, you know, all kinds of things are likely to happen. And so how do we make sure that if somebody shows up at my door and I'm not the right person to see them, I can easily get them somewhere else? And I think that it does take some policies and practices that are above our individual organizations, because a lot of times, like I think about the doorway contract and or some other contracts that happen, you know, there's a lot of competitiveness sometimes to them. And how do we make sure that even at the high level, at the policy level, at the program level, that there is that connection and that community is required, rather than kind of setting us up to be competitive with one another?
Thank you. Jess? And then Mike, and then Bobbie.
Awesome. So I don't know if there's, for me, I don't know if there's such a thing as after COVID. I think we have to start accepting that this is the new norm and accept that, you know, we're gonna have to change the way we deliver peer recovery support services. And that's gonna change forever. You know, we're trying to prepare for what's next. However, the barrier is that some of our contracts are specific to certain substances when we know that even others are on the rise. You know, we're forgetting about things like I mentioned before, such as alcohol and meth. And also some of our contracts are being tabled. And I understand that COVID is a priority right now. However, we can't forget about our substance use. We can't forget about our recovery community members that are struggling. And, you know, I would argue to say that our recovery community is struggling more than most right now. We've developed this, you know, human connection and, you know, this routine of going here to get our recovery, to talk to this person and do this and engage human to human. And, you know, we're kind of forgetting about that. With our friends over at Greater Nashua Mental Health, we launched our ACEs Crisis Team project a couple weeks before COVID hit, which totally threw a wrench in it. And, you know, I would love to like relaunch it at a time where we can go out into the community more and, you know, build more relationships, because we know that that's still happening. You know, I'm hearing about it on a daily basis. We know that children are being impacted by the substance use. We know that people are being impacted by the substance use, and things have changed a lot in how we're able to go. So, you know, I need more hands. We've never been busier at Revive. On a daily basis, we have people calling, trying to get connected. So, you know, don't forget about us.
Mike?
Yeah, so I'm going to respond two different ways to that. One is as a, you know, as a nonprofit, as an organization in the community, the way I believe we need to prepare is through the lens of we don't know what's next and we need to be flexible. And that's what we've all been all along, is adapting to new ways of doing business. And I think that's a little bit of what Jessica was kind of getting at. And we're prepared to do that. A different perspective is as a grant-making organization. So the state of New Hampshire is a grant-making organization. The city of Nashua is a grant-making organization, and United Way is a grant-making organization. And so what we have in common is when we write a grant, we write it for organizations to do specific things. and then we ask them to report on those things. And when times are changing and things and the world is fluid, the way in which services are delivered can change dramatically. So I think it's important, and we're looking at this as a united way, is, you know, if we have paid an organization to do X, but they're now doing Y because of this situation that we're in, is the outcome ultimately providing a result that is in the community's best interest in the way in which we want it to be. We're able to have that flexibility, but those of you who maybe have some participation, for example, in the executive council, might consider that organizations that you've written contracts with might be doing things differently than those contracts had originally presupposed. And please, some level of flexibility with regards to compliance and measurement would be, I think, a huge, huge win for our nonprofit organizations receiving grants.
Lisa, I thank you for that question, and it's a really, really important one for us as a community and as a region. And you know, with working with our staff here, and I mean, there has been a phenomenal response by the division across all of our departments for COVID. And one of the things that I constantly say to our staff is that we cannot go back to doing things the way that we did. And we hear a lot, you know, let's get back to, well, we shouldn't be looking to go back anywhere. COVID has given us and allowed us for opportunities, you know, to be expanded and to be greater across all of our organizations, across our community, you know, our legislators, you know, our city departments. We have been working together for the past 11 months phenomenally. And that's how we have to continue to go forward. So we can't go back and start thinking about, you know, my organization. We have to think about our community, our organizations, how we work together. Even when it comes down to looking at, you know, getting funding and funding streams, we have to think about the greater impact, right? So that's what COVID has actually unveiled to us, is that we have to look at things broader, right? We need to embrace what we have learned from the lessons that we've learned, you know, throughout this time period, and then we need to build upon them. So as we prepare, and I know that folks are saying it's hard to prepare, we don't know how to prepare. We've been doing this all along. It's got to be fluid, it's got to be adaptive. But Nashua, Greater Nashua region, you've been doing it. We have to continue in what we've been doing, keep the communications going, keep working together as organizations, partnering together as we address the needs of our community. So we're not going backwards. We're not looking for doing things the way we used to. We're looking to moving forward, embracing all of what we've learned through our lessons, taking advantage of all the opportunities that have been presented to us to make things better for our organizations and the services that we provide in our communities. So it's going to take all of us doing what we're doing. It's going to take our legislators that are here with us this morning, working with us, reaching out to us and asking us questions, and then us working together to give the answers that they need when they're making those decisions at the legislative level.
Thank you everyone for answering that question. I'm going to start with questions from the audience. The first question I think is for Kristin. Since the conclusion of the Safe Stations program in the city, is the city working on a local partnership to provide after hours access for people seeking recovery, or are we just partnering with 211 at the state level?
So the Doorway, Southern New Hampshire Health, have partnered with Gatehouse to offer a location for individuals to go to after our hours. So it's kind of a mix. So they still will be contacting 211, and depending on what their situation is, may go to the respite. If they need emergency services, go to the hospital. But Gatehouse, they can stay there, be safe and warm, secure, and then come to the Doorway the next business day, if you will. So from what we've been hearing, I reached out to Chief Rhodes. There has been minimal people showing up at the fire stations. So I guess the word is out there. So that's great news. So we're excited to be able to offer that as a service and hope to see more people become aware of it and utilize it.
Thank you. I have next question to Bobbie Bagley. Thank you for providing vaccinations to the Nashua Soup Kitchen folks to reduce community spread. I think this question is more about equity in vaccination. Can you talk a little bit about how that is working through the City of Nashua Division to provide a little bit more health equity to the distribution of vaccinations?
That's a great question. Thank you, Lisa, and thank you for the person who sent that question forward. One of the things that the state is being very intentional about is making sure that there is vaccine allocated to individuals that have traditionally been underserved in our communities. We've been talking about making sure that we all take an equity approach in our services and our solutions, and the state has actually built that into the vaccination program. And I do believe it's actually coming from a federal level because of the data that we've been seeing. So everything that we have been doing has been data driven. So our 1A vaccination rollout was to make sure that we would have the workforce needed, right? And to protect that workforce and to make sure that that workforce is protecting those that they serve. With the 1B rollout, again, data driven, looking at who's being mostly impacted by COVID in our state with disease and with, unfortunately with deaths as well. And so for this equity allocation, it is the same. So there are going to be community clinics that are held to make sure that we can get to individuals and get vaccine in the arms of individuals that may not fit into a category like 1A or 1B, but we've seen the impact in that population group and the data on their disease, their morbidity, and the mortality, disease and sickness in those population groups. So that's going to include our racial and ethnic minority populations with a priority to get vaccination into those arms, individuals where there's language barriers, individuals that have barriers to transportation, to getting to like the fixed site over at Nashua High South. We will be intentionally reaching out to those population groups to get them vaccinated by providing mobile clinics around the city. So right now we're looking to partner, same way we did with our testing clinics, with Nashua Housing. We're looking out to our senior housing facilities, and then also our faith-based community, because we know our faith-based community has connections. And then we're also going to be working through all of our partners, all that are seated here on this panel, to make sure that we get individuals that can't get to those other sites, and again, meet that that equity allocation as defined by the state. You can go on the website and you can see, the list there for those individuals. It's based on income. It's based on the census tract areas that have been identified by the state. And again, like I mentioned, transportation, race, ethnicity. And then for other very specific things, folks can always just give me a call. But we're very intentional about making sure that that happens. Those clinics will be offered at least weekly.
Thank you. The next question is for Dr. Whitaker. How is recruitment for ProHealth New Hampshire program in Nashua?
Oh, so ProHealth is a program specifically for youth and young adults to receive integrated primary care, and so that they enroll in primary care services here within our agency while they're also receiving behavioral health services. And then there are specific incentives for them to engage also in things like smoking cessation programs or specific targeted programs regarding weight management or other health behaviors. We are the leader across the state. There's 3 regions doing ProHealth programs, and we have, because we already had the existing relationship with Lamprey and our Integrate program, thanks to the IDN, already had some youth in that age enrolled with us. So we're very proud of the work that we're able to do. And if somebody's specifically interested in that program, if they want to let me know, and I can connect them to the director of that program to have a follow-up conversation with them.
Thank you. Next question is for Kristin. Regarding the opiate and stimulant use grant, is this a federal grant? And when did it change to include stimulants?
So yes, it's SAMHSA grant through the state of New Hampshire. January 1st, it began including stimulants.
Thank you. What is the role of adequate broadband in delivering services? I think you kind of touched on that a little bit earlier, but one of the audience members, I think, wants to get a little bit more information on the role of adequate broadband in delivering services. Mike?
So I don't know anything about telehealth, so I'm probably the wrong person to answer that technical detail, but what I can tell you about broadband is what we see with with the internet access in general for the schools. And of course, we all see this on our little Zoom sessions that we do all the time, right? If your connection speeds are only in the 25, 30, 35 megabit download speed, then you're going to see yourself freezing up all the time, and that's going to be exactly the same as for telehealth, and that's with internet access. Now, I can tell you that even a Wi-Fi hotspot, the Wi-Fi hotspots that we're distributing have about a 10 megabit download speed. That's pretty common for Wi-Fi hotspot type access. I suspect that that's not sufficient for telehealth to have a reasonable conversation. So I think broadband, true broadband internet access and really fiber is ultimately what we need to move and transition into a world where these things are truly efficient and truly effective. I think it's key. It's absolutely critical.
So I can speak a little bit more to the telehealth side. So luckily, we've had the flexibility for telehealth definition to be both video or just audio currently, because there have been times where we've had both the clinician and a client ready to go, able to have a video conversation using the technology, but then it freezes or we can't see the video. And so we have to shut the video off in order to be able for the audio to work. And so without that flexibility, we would have had to discontinue the session. Sorry, your video's not working. We can't see you. This is no longer considered telehealth. But thanks to the audio only flexibility, we were able to continue the conversation, figure out if we could get them back on video, have somebody do an audio session like for community-based supports to help them manage their anxiety about trying to get connected to the video. So really, without the significant broadband, the audio only flexibility has been a lifesaver for us. And without it, we would have been not able to provide services to a significant population that doesn't have that same access. And so I do think it's an equitable issue to talk about as well. That so anyway, those are my thoughts.
Thank you. The question says, thank you, Cynthia, for highlighting all the aspects of loneliness. What is being done in the community for internal connection with the self?
Could you repeat that question?
Definitely. It says, thank you, Cynthia, for highlighting all the aspects of loneliness. What is being done in the community to address the internal disconnect with self?
I think this is a great place where we really need public health and kind of education to come into play, that those feelings of disconnect within self are normal during a crisis like this, that after an adverse experience, it's normal to have these feelings. It's okay to talk about them. People that have heard me speak before know I often talk about like a triangle, and that when people need help, really a lot of people can get a help from faith-based communities, friends, family, and only a small number of people at the top of the triangle need inpatient, etc. But if we stay silent, if we think I can't talk about it, if we think this isn't normal, then the people that could have gotten help down here end up getting help up here. So I really think education, just decreasing stigma, all of those kinds of things are what we need to do more of.
Go ahead, Mike.
Sure, I'm going to give a selfish answer to that. If you really want to address loneliness and isolation in a community, one of the best tools you have at your fingertips is volunteerism. And we've seen that huge, we've seen a spike in volunteers. At United Way, we've had over 800 volunteers since COVID started that have logged over 12,000 hours. Each of those hours is a person helping another person, connecting to another person. That helps two people at once. I see no greater return on investment in our community than promoting volunteer connectedness, whatever that means. I don't really care if it's at United Way. It could be at the soup kitchen. It could be at Revive. It could be, at the Humane Society. But whatever we can do to promote volunteerism as a community will help address these issues permanently.
Next question. How do you suggest that we partner with schools to assure equitable social, emotional, and scholastic achievement? How do we equip our families to help their children cope with the changes brought by the COVID-19 pandemic?
Well, we have a volunteer program that we established called Learn United, which is a volunteer tutoring program where students self-refer, their families refer them, and their teachers refer them, and they get connected to a volunteer tutor. And the tutoring takes place either online or in person within one of our youth organizations like the Boys and Girls Club. And what we're seeing, and this is, one of my volunteers happens to be also a board member, and she shared with myself and Dr. Whitaker yesterday morning at our board meeting her experience of working with, I believe, an 8-year-old. They meet weekly at the Y, and of course, the whole approach is supposed to be around academics, but this 8-year-old girl, she just wants to play. Honestly, she just wants to connect to another human being. I think, again, I would come back to whatever we can do to promote that volunteer connectedness. I'll just talk about one specific organization, and that's Big Brothers and Big Sisters. Big Brothers and Big Sisters has always had a huge need for volunteers to step up, in particular males, to be bigs for young men and boys. And so seeking those opportunities out is a great way for us to help our community and address the needs of our youth.
Bobbie, did you raise your hand?
Oh, that was a staff person waving at me, but I can't, sorry. You know what, I would just echo what Dr. Whitaker and what Michael are saying about the connectedness. And it doesn't take, and you guys know me, it's very simple as acknowledging just that people exist. Even though we're wearing these masks, we're still walking down the street, we're still seeing each other. We don't have to be isolated in those spaces either. We can still recognize each other, a nice little wave, or a hello, because you can still hear through the mask, right? And so that connection can take place in a lot of different spaces, over a lot of different areas. The question was specifically about, how can we help the schools? We have had some very strong parent advocates, that have been engaged in trying to get, the kids back in school, getting kids, kids connected, because they feel that that's the best learning environment. And I would say that same passion for, parents, teachers needs to go across the board with just the things that Michael's talking about with that volunteerism, because we're going to need that. When we come out of this, we know that some students are going to be behind. We're going to need the whole community. We're going to need the village to help support all of these kids getting back on track. And so getting engaged with organizations that have volunteer opportunity is going to be important. things that the school may set up with groups. They've got their PTAs as well. All of these avenues are going to be great opportunities for that connection to take place, you know, in a way that allows for us to heal and build our resiliency as a community together, and then tapping into the resources that our organizations offer as well. So parents, call, ask, what do you need to do? How do you do it? What do you need help with? But that we all think about all hands on deck, because that's what it's going to take, us doing this together, and that spirit of volunteering, that spirit of love and compassion towards each other. We're going to have to do that as a community.
Jess, did you raise your hand?
I did, and you know, the schools aren't necessarily something we're like, you know, closely entwined with. However, I can speak, you know, from personal experience and having children and serving on, you know, a PTO. I just want to mention that, like, you know, I've never seen such creativity. You know, the PTO still coming together on a monthly basis and, you know, coming up with these new creative ways to help support our children. I think we are still kind of lacking, you know, resources for our children right now. You know, I've seen the impact on my little one who's, you know, supposed to be in first grade in person at Fairgrounds Elementary School. And he thrives off being around his friends. You know, they're at that age where he needs, you know, kids around him. So I've had to get a little creative and, you know, get him involved in karate, and like there's even like virtual options for that right now, which, you know, super convenient because he's, you know, I can just notice he's getting a little wired and need to connect, and I can, you know, tune into the dojo and he can do his thing. And, you know, the volunteerism, I can comment at Revive that we've seen a huge influx of people trying to help other people. And that's what it's all about. You know, we've been able to utilize them to expand our SANA, our syringe service program, service delivery hours. So, you know, we're all in this together, and things are changing, and they're going to change forever. And it's about accepting it and coming together and coming up with solutions for our little ones, for our future. Community is great. So proud to be a part of it.
Thank you. This is going to be the last question. This is Alderman Clean. I don't have a question, but I want to express my gratitude to all the panelists for all their flexibility. I have watched each of these groups and more grow and teach us all what can be done with such a horrific situation. That the fact that everyone band together shows the community commitment that they or we all have. Was never a word heard through all of these. It truly warms my heart, and thank you. I think that really puts everything together, the fact that we have been focusing on building resilience in our community for the last 3 legislative breakfasts, for the last 3 years of the Mayor's Opioid Task Force. That has been our commitment to make sure that we can work together, increase collaboration, because it does take a village. And I think the fact that Nashua has all these organizations that work together really not only warms the alderman's heart, but warms my heart, and I think all of our hearts, that there isn't a time, I think, where there is a need on any of these panelists or any of the Mayor's Opioid Task Force agencies, where there is a time that they feel that they cannot reach out to someone. Like if I need to, you know, reach out to Dr. Whitaker or Kristin or Mike or Jess, I never have a hesitation. I know that they will pick up the phone, and I know that if they can't help, they will find the way of me getting that question answered or getting that support that I need. And I think that goes for each and every one of you. And I think that is what makes Nashua such a great place, or Greater Nashua such a great place to live, play, work, and pray. And I do hope that we are able to continue these conversations ongoing. You will be getting an evaluation after this legislative breakfast is over. please fill it out. If you have any additional questions or you need to contact any of the panelists, we will have links to their contact information and their agencies, as well as other agencies that work throughout the Greater Nashua Public Health Region to provide services for our community. Is there anything that our panelists would like to say as a farewell? Bobbie Bagley.
Did anybody else want to go first? Okay. So just in closing, again, thank you everyone for joining us this morning. We really do appreciate you getting up early, spending this time with us. For those who are able to stay on the whole time, we really appreciate you being here. And we appreciate the services that everyone has been providing, all the sacrifices that have been made to help maintain the safety of our communities. You know, wearing masks is not something that, you know, we all love to do, but it's something that we know is expedient, and it's something that we know that's necessary. We are going to need to continue with that vigilance as we continue to go forth, at least, and some people are not going to like to hear this, but we're going to have to do this at least for probably the next 5, maybe even 6 months, because we're rolling out the vaccinations now. And as we're doing that, people are going to still need to wear their mask until they get that second dose and until everybody has gone through and gotten those second doses. So that's going to be a while that we maintain this vigilance. One of the things that I really wanted to stress, again, to our legislators and to our leaders, when COVID hit, we realized that we were underfunded across a lot of areas to get a lot of things done, across all of our nonprofit organizations, across our for-profits, our businesses, you know, our hospitals. We heard that from our community. We do need for those things to be taken into consideration because we still are in the pandemic and we still need to continue to go forward with this. Public health historically has been underfunded. We were able to get some additional state funds from the CDC, from FEMA. Those things are not going to last. So we need to keep those things into consideration as well. Our organizations, you've heard about the services, the barriers that our organizations experience with regards to being able to provide the services. All of those funding needs and issues need to be kept in mind and considered going forward. So again, not going backwards, but as we go forward and as we're thinking about what we need to continue to provide, the phenomenal services that have been provided, building upon the lessons that were learned, funding resources are going to be important. Human capital is important, and we've already heard how important it is for that human-to-human connection to be able to take place, and that resource needs to be there for that to happen. We can build a happier, healthier Greater Nashua by attending to those needs. Thank you.
Thank you everyone for joining us. It's 9 o'clock, so we will you know, end the recording and end this conversation, but the conversation continues as we go forward and do the work that creates resiliency in our community. Thank you again.
Thank you, everybody.
Have a great day.